Hi, this is Diane Greco-Allen, and I am doing a second episode on a book review that is about Scleroderma. Now, it's taken me some time to go through this book a little bit, but after going through it all and going to some of the IFM conferences, which is the Institute for Functional Medicine, the Integrative Holistic Symposiums, and other different like online conferences related to Cornell and nutrition in different aspects of nutrition and seeing what's out there. And also coming from Functional Medicine Coaching Academy and being enrolled presently in the Functional Nutrition Academy, which actually is Functional Nutrition Alliance with Andrea Nakayama. So I really wanted to go through things because I do cover a lot of things in my book, which is It Might Be Your Pancreas, and a lot of the medical terminology. And if you go back to the references, I wish I would have done it a little differently, but I'm learning. And it takes a lot of patience and time to put a book together. So I tried to cram in as much as I could, but I wanted to really get to the pain portion of things. And what I really found out is that in scleroderma and rheumatoid type diseases, there's always some underlying ruminating type of infection that might be taking over in your body. Now, personally, I had pneumonia when I was a young girl, and I was eating all the wrong way. I was in a family of 6, and our routine was just get up and go to school, and sometimes you missed breakfast, sometimes you ate most of the time I ate my lunch. I was told to value my meals, but not everybody is adamant about their routines during the day. And from what I see in this book, they tried so hard to get some kind of a routine down with these medications, antibiotics. And I went through different areas of the book that, we're talking about using Pepto-Bismol, which is bismuth, the antibiotic, which is metronidazole. I can't even pronounce these names, but that's usually for yeast, which is, there's another name for that, and tetracycline. So there was a lot of antibiotics throughout the book that were mentioned, and minicin was one of the ones that they said were the original ones that could actually help their clients. And so after reading if you go through the back of this book and in the index, it talks about many aspects of, I saw some things in here about adrenal crisis, and that just triggered a lot of things for me because I was in a wheelchair twice from, I believe, adrenal crisis, and not diagnosed by any doctor. I had been to 5 or 6 different endocrinologists. I kept on telling them I'm dealing with something that's going on up here because I would have these hot attacks and all this stuff. And thyroiditis is really common, especially after you have your children. And if it's not treated properly with your diet, you continue to have these problems, and then you start acquiring more diseases. Now, after my first C-section, I had an incisional infection that needed to be packed. And I personally believe that that infection never left my body. And by the time I was 50, after being on 15 different prescribed medications by my doctors, I realized that, these medications may be causing more damage than helping me. So that's when I decided to be my own advocate. But some of the things that I saw in the back of the book about minocycline, And they were trying to figure out who were these valuable people in their studies that they could say, this actually worked. And there was some that died along the way, maybe because the therapy was too aggressive for them, and maybe because they did not have viable nutrition in their body. And that is what functional nutrition is all about. But in the last part of the Lancet article, it said 5 patients did not complete the study, 2 with renal crisis, 1 died of adenocarcinoma, which was cancer, 2 were non-compliant, and 2 episodes of vaginal yeast infection. So here's something to consider. Everybody that is treated for cancer usually has an underlying yeast infection. And what they do is they treat you for your cancer, and then you are in a place where these things surface in your mouth. My mother had it all through her abdomen. It was horrific. She had terrible yeast infections, vaginal yeast infections. She had ovarian cancer and was treated for 18 years with different types of chemotherapy. And so I watched my mom progress into this state of, it was terrible. She was cachectic. I mean, her body just, it was sucked dry. And the tumor that eventually took over her entire rib cage. So we could see it. It was all through her upper abdomen and her rib cage. And they said that was part of the ovarian cancer, what I personally believe it was a secondary cancer that was undiagnosed. She also had hip issues where her bones were brittle, and they would not do, she didn't want to do surgery on her hip because it was bone on bone. She had no cartilage there. And so her body was just literally eaten apart by either yeast, a combination of yeast, the virus that caused her cancer, and then that goes into the connective tissue issues with arthritis. You know, we got to think about how these things get into the tissues, and then what are you treating? Now, I believe that there might be a good combination that could work very gently, because if you overstimulate the body, and some of these people are very, they're in already in just that area of adrenal crisis. If you push it to the limit, you're going to kill them. So, you know, this scleroderma, I understand that a lot of people are reaching out and they want something immediate. And it's sometimes that's when things sort of go AWOL. And you want that immediate, you know, treatment option. How is this going to be beneficial? And thinking that food might get in your way, you know? Oh my gosh, you mean I have to stop eating my ice cream because because of this? You know, and thinking that just these antibiotics and all these other treatment options are going to be the answer. This is where we have to change our mindset. And we have to realize that if you want your immune system to actually work and your digestive system to be functional, you've got to allow the absorption and the digestion and feed your body the proper nutrients. Because if you rely on the processed foods and the carbs and the sugars and everything that actually from the time that we learned about food and creating it, so many people are saying, oh, but those people over there, they lived forever. Yeah, but their bodies were these obese women that were like, no, they didn't live forever. Yeah, they might have lived forever and lost their minds, or, you know, they don't have a memory. So you got to really put this into perspective. You know, so many people go off on this, well, if I use this type of flour, that was from the old country. Well, that might be true that that type of flour from the old country might help you a little bit, but if you're eating a ton of it or you're not eating on time and you're not feeding your immune system and you're not sleeping and you're not moving and getting your lymphatics and cardiovascular system working a little bit, none of this matters. So, let's get real. Let's get real about what is going on. And these infections that, women go in for surgery and C-sections all the time. And when you got post C-section, it's a trauma to the body. You just had a baby for 9 months, you've been running a marathon there, with your body running like an engine, propelling for 2 or more children, whatever, how many are in your uterus. So, really, really think about these. I want to give a lot of credit to all the Harvard and all the doctors that really worked hard to figure this out. This took time, but they were eating wrong too. I saw that they were having club sandwiches in the book, as we sat down and had our club sandwiches. How's that going to help anybody if you think that eating a club sandwich is okay? And then looking at these extreme scenarios and trying to figure it out with drugs. So I'm going to put some positive energy out there today because I know that a lot of people are in pain, either from pancreatitis, which can be a part of every disease, and or dealing with this chronic fatigue, chronic pain. You're worn out. There's so much going on in your life, maybe emotionally. You're overwhelmed with everything you see in the news, and you just need to focus on where you are with yourself, and just use today and build your little routine for yourself. Don't starve yourself. You need to have that food, but it's got to be in small windows for this digestive system to work. So I have 5 points of awareness with my boundaries on one hand, and then I have my 5 W's with my how much on the other hand. So that's your, what you are for your frame. You think about your body frame. You don't want to overpower it and put a lot of stress on your organs. And you want to keep your mental capacity working. So you need a lot of good fat for that, those neurons to work and all that, everything to flow properly and homeostasis around all the cells, everything it needs to be nourished. And I wish you well today. And if you're dealing with anything that is related to arthritis or rheumatoid conditions, along with any surgeries or injuries or infections, really take into consideration what you're putting in that mouth, okay, and using as nourishment. Diane Greco-Allen, food relationship coach, pain management, very focused on perinatal nutrition and, what's going on in our childhood with nutrition. Thank you and have a great day.